While a cancer diagnosis is never easy to hear, a new immuno-oncology treatment option is now available for certain patients with hard-to-treat cancers, including head and neck. This year alone, more than 64,000 new cases of head and neck cancer will be diagnosed in the U.S., resulting in more than 13,000 deaths. Well, joining us this morning to talk about the latest in treatment and patient care is Dr. Michael Gibson, Medical Director of the Head and Neck Team at the University Hospital's Seidman Cancer Center in Cleveland, and Carly O'Brien, Caregiver Program Coordinator at Cancer Care. Welcome to both of you.
Hey, good morning. Thank you.
Thank you.
Thank you for joining us. So we're really going to cover both sides of it, the cancer itself and diagnosing it, and then the resources that people have. So Carly, we'll get to you in just a bit. But doctor, let's start with you. Cancer, specifically, the neck and the head is becoming more prevalent. Can you tell us what exactly it is?
Oh, certainly. It is, as you said, a rather common cancer, but it's somewhat under-recognized and misunderstood. Nevertheless, the description that I use is to say that the cancer can involve any of the structures of the head and neck, with the exception of the brain. And that might include, for example, the voice box, the tongue, the tonsils. And within the head and neck, therefore, there are a number of subtypes of cancer, but we envelop them in an all-encompassing term called head and neck cancer.
Okay, and what are some of the symptoms that people might notice if they're affected by this?
Yeah, the symptoms of this, although often nonspecific, so not every one of these may lead to a diagnosis of cancer, but they usually are related to the subsite involved. So, for example, a voice box cancer could show as hoarseness of voice. A cancer of the tongue might show a lesion with some bleeding and pain. You may have some swallowing difficulty. So those are a number of things you might find.
Okay, and the good news is, though, that there are treatment options that really are made to battle this type of cancer. And what are some of those that are available now?
Yeah, absolutely. So there are not only currently approved treatments, but I wanted to add that with clinical trial support, there are many, many treatments in the pipeline being developed, so there's hope for the future. One of the treatments that has come to light over the past couple of months is a drug called nivolumab, or Opdivo, which is an immunotherapy, which actually fools the patient's own immune system to treat the cancer.
Got it. And of course, there's the medical aspect of things and treating it through medicine. But of course, Carly, you come in with the support and the resources for people. So really, what's available out there for them?
Luckily, there are a lot of resources out there for patients in general, and particularly patients living with head and neck cancer. There are organizations like the Oral Cancer Foundation, the Head and Neck Cancer Alliance, which aim to provide information and resources about the disease itself, and also have a lot of advocacy efforts. Organizations like Cancer Care provide free professional supportive services to people with any type of cancer, so free support groups and individual counseling with a licensed social worker. So I think it's really important that patients living with this disease recognize that there are really good resources and a lot of information out there. Sometimes it's just about knowing where to look.
Well, it's extremely important to be educated. I have a family member who unfortunately has been touched by this very recently. So, my family and I understand, what it is to learn all about it. You don't always want to know everything about cancer, but sometimes you just have to learn, unfortunately. So, doctor, before we let you go, where can we go and learn more information?
Yeah, first of all the best to you and your family. There are two websites I would suggest. One is for the National Cancer Institute, which is cancer.gov. And the second resource is from the National Comprehensive Cancer Network, or nccn.org.
Okay, very good. I appreciate the well wishes, and I want to thank you so much to both of you for joining us today.
Thanks. Take care.
Thank you.
All right. Now, guys, stay right where you are. We'll be right back.